Now we will learn the gallbladder meridian of foot shaoyang. We will learn it from two aspects. The first is the rough causes of it. According to the name of this meridian, we can know the rough causes of it. The directions is from head to foot. It's distributed mainly on the middle lines of lateral side of the lower extremities. On the head and the trunk is also on the lateral side of it. Inside, it's connected at least two organs. The first is the gallbladder. The second is its interior and exterior related organs, liver. The second for this meridian is the acupoint of it. It starts from 童子瘤 gallbladder 1 and ends at 足少阴 gallbladder 44. It's distributed also bilaterally, both sides of the body. Each side consists 44 acupoints. The very important points we will learn. The first is gallbladder 20, 风池. First, for the location of these points, it's on the neck and in the depression between the upper end of the sternocleidomastoid and the trapezium muscle. For the indications, we have mentioned all the name of the points is not just name, it has the deep meaning of it. For these points, the Chinese name is 风池. Feng is wind in English. Chi is pond in English. So 风池 means wind pond in English. So this point is a very important point to expel wind. So it can reduce the wind inside. It can reduce inside wind like the apoplexy and the convulsion. It also can expel the external wind. The wind evil attack our body. The external evil attack our body, the patient will have the facial paralysis or the common cold. This point also can use for the headache and dizziness. These symptoms are always caused by the Western medicine disease like the hypertension, cervical spondylopathy, and ear problems like the Meniere syndrome. It also can treat. The third indication is the eye problems and the ear, nose, throat, ENT problems like the pain in the eyes and the ear, Meniere syndromes, and the nose. The third indication for this point is to treat the eye problems like the pain in the eyes. It also can treat the nose problems like the rhinitis, allergic rhinitis or chronic rhinitis. It also can use for the throat, the pharyngitis, also can for the ear, the Alzheimer's problems, and also the otitis. The fourth indication is the local use of it, the pain in the neck. For the methods, we always insert a needle obliquely, also slightly downward or towards the other eyes. When we insert a needle towards the other eyes, it's better to insert a needle slowly inside of it. Avoid injure the medulla oblongata. Moxibustion also can be used. Next commonly used point is gallbladder 34, 阳陵泉. The property for this point is Hersey points, lower Hersey points, and the influential points with the tender. For the location of these points is distributed on the lower extremities. It's in the depression anterior inferior to the small head, anterior inferior to the head of the fibular bone. So for the indications, The point can use for the flaccidity syndromes, it's V syndromes, and the pain syndrome, also named the B syndrome, in the lower extremities, and the swelling and the pain in the knee and the hemiplegia. We always use the local point together to treat it. The second indication for these points is the pain in the hypochondrium, just because the meridian passes through the lateral side of the body. So it can treat it. We always combine with pericardium 6. It also can use for the vomiting, jaundice, just because it's the lower Hersey points. When we treat it, we always combine with Ren 12. The last indication for the points is the can treat infantile convulsion, just because the convulsion is tender's problem. So this point is the influential point of tender, so it can use for infantile convulsion. For the methods, we always use filiform needles, insert it perpendicularly or obliquely 1 to 1.5 tune. Moxibustion also can be used. That's all for this meridian.